COVID-19 is caused by a member of coronavirus family that has never been encountered before. Like other coronaviruses, it has transferred to humans from animals. The WHO has declared it a pandemic. Signs and symptoms of COVID-19 may appear 2 to 14 days after exposure and can include fever, cough, shortness of breath or difficulty in breathing, tiredness, aches, runny nose, sore throat. The severity of COVID-19 symptoms can range from very mild to severe. Some people have no symptoms. People who are older or have existing chronic medical conditions such as heart or lung diseases or diabetes may be at higher risk of serious illness. This is similar to what is seen with other respiratory illnesses such as influenza. Other specific symptoms to look for are a high temperature, you feel hot to touch on your chest or back, a new contagious cough. This means you have started coughing repeatedly. As this is viral pneumonia, antibiotics are of no use. The antiviral drugs we have against flu will not work and there is currently no vaccine. Recovery depends on the strength of the immune system. Most people infected with COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice a respiratory etiquette, for example, by coughing into a flexed elbow. The best way to prevent and slow down transmission is be well informed about the COVID-19 virus, the disease it causes and how it spreads. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. Although there is no vaccine available to prevent infection with the new coronavirus, you can take steps to reduce your risk of infection. Some precautions that you have to take. Avoid large events and mass gatherings. Avoid close contact about 6 feet with anyone who is sick or has symptoms. Keep distance between yourself and others if COVID-19 is spreading in your community, especially if you have a higher risk of serious illness. Wash your hands often with soap and water for at least 20 seconds or use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover your mouth and nose with your elbow or a tissue when you cough or sneeze. Throw away the used tissue. Avoid touching your eyes, nose, and mouth if your hands aren't clean. Avoid sharing dishes, glasses, bedding, and other household items if you're sick. Clean and disinfect surfaces you often touch on a daily basis. Stay home from work, school, and public areas if you're sick, unless you're going to get medical care. Avoid taking public transportation if you're sick. Also, it is not recommended that healthy people wear a face mask to protect themselves from respiratory illness, including COVID-19. Only wear a mask if a healthcare provider tells you to do so. Avoid eating raw or uncooked meat or animal organs. Avoid contact with live animals and surfaces they may have touched if you're visiting live markets in areas that have recently had new coronavirus cases. If you have a chronic medical condition and have a higher risk of serious illness, check with your doctor about other ways to protect yourself. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. Stay safe. If you like the video, do subscribe to get contents like these, and also it would make me happy.